Hi, my name is Nabilah, and I'm the Community Engagement Trainee Lead in Calgary for Wear Red Canada, and I'm here to talk to you about heart disease in women. Heart disease is also known as cardiovascular disease and is an umbrella term used to describe conditions that affect the heart and blood vessels. It is the leading cause of death worldwide. And although we have made great strides in research, diagnosis, and treatment of various cardiovascular diseases, it is on the rise and remains the leading cause of death in women. In fact, cardiovascular disease claims the life of 1 in 3 women worldwide, and 1 Canadian woman dies of heart disease every 20 minutes. When women are asked what their greatest health threat is, most will say breast cancer. But the reality is that 5 times as many women die from heart disease as breast cancer. Overall, women are understudied. Despite the fact that women make up just over half the population, 2/3 of clinical cardiovascular research focuses on men. They are also underdiagnosed, as early heart attack symptoms are missed in up to 78% of women, as they may have different or more subtle symptoms when compared to men. Women are also undertreated due to lack of awareness and knowledge gaps amongst healthcare providers. Women are undersupported. For example, after a cardiac event, cardiac rehabilitation can reduce the risk of death by 25%. However, women are 50% less likely than men to participate in cardiac rehabilitation due to lack of physician referral, lack of personal time, and because women often put their own needs last. Women are also underaware, as there are substantial gaps in women's knowledge of heart disease and a disconnect between their perceived risk and actual risk. For example, 60% of Canadian women at high risk of cardiovascular disease perceive their level of risk to be low or moderate. The mission of Wear Red Canada is to increase awareness for women's heart health in the community. Wear Red Canada is celebrated annually on February 13th, and this year we have partnered with the Libin Cardiovascular Institute at the University of Calgary, and they are extremely dedicated to improving cardiovascular health in women. They have created a webpage called Libin Wears Red in support of Wear Red Canada, which has the signs and symptoms of a heart event in women. They also have a calendar of events that are occurring around Wear Red Canada Day. Their dedication to women's heart health has resulted in the formation of the Women's Cardiovascular Health Initiative, and their mission is to close gaps in research, training, and care to enable the best possible outcomes for women. Let's work together to share this important message. We hope to see you all on social media on February 13th wearing red and using the hashtags Her Heart Matters and Libin Wears Red. By starting conversations about women's cardiovascular health and getting informed, we can increase awareness and improve the lives of the women we love.